Hello and welcome everyone to my channel. I'm Dr. Nancy and today I'm going to be chatting a bit about neck pain. Neck pain and as a sideline headaches, which can come from neck, is one of my most encountered issues in my everyday clinic. So I'm going to give you a bit of good advice as to what you can do at home to help manage some of the symptoms. So first and foremost, this is just general advice. It doesn't replace what you can actually get from going into seeing a health professional. So please don't hesitate to do that. But these are just some of the things that you can do at home. So I'm just going to briefly explain neck pain. So the source, this is my friend little spine here. So the source of neck pain can come from a few structures. So basically these are all the bones in the neck. There's 7 of them that line up together and then it goes into the mid-back area. This is the base bone of the skull, the bottom of the skull right there. So the muscles around this area are quite little, and then you've got the bigger muscles of the shoulders that go on through here. So these two structures, the small muscles and the big muscles, can be a pretty constant source of neck pain and headaches. So really the number one thing is to make sure that you try to maintain your good posture, especially if you're very desk bound at work, or you have a job where you're always doing something in front of your body, because what happens is you end up doing this. Okay, so really you should be having shoulders down, chin tucked. Ergonomically, you need to make sure that your computer screen is at level where your eyes are. Your mouse is close to your center, your belly button, because if it's all the way out here, that's going to cause a problem with this muscle here, the upper trap. It can also cause shoulder instability. So we're trying to get the mouse all the way here so that you're sitting properly. Keyboard also close by. Your chair should be at the right height for you, that your hips shouldn't be too far away from the desk, and your knees need to be at a right angle. Okay, so bent like a square right angle. So really, if we can maintain a good posture, then it means that these muscles are not copping a lot of tension on them the whole day, especially when you're working, a few hours at a time. Try to have frequent breaks from being seated, especially if you do have a seated job, and especially if you're also having a physical job where you're doing repeat activity with the shoulder, arm muscles and things like that. So the other structure, apart from the muscles where you can have problems, is the facet joint. So the facet joint is the little bit, I'm not sure if you can see that. So in between the bones, you've got little gaps, okay? These little gaps, they line up together like this, okay? And so you've got a bone here and a bone here, and they have a little bit of fluid in between them. So that fluid is called synovial fluid. So that synovial fluid can get inflamed, and the facet joint then might not work properly. So this problem usually does need professional attention. So you might need to go to your healthcare professional to get the joint adjusted, chiropractor, physio, manipulative physiotherapist. Some physical therapists can mobilize, and some physios can mobilize. So mobilization or adjusting aims to get that facet joint, which might be have inflammation or have restriction, to move properly again. That is important. Muscles, you can either get a massage, or basically I'll show you a couple of really good stretches for the structures there. So basically the main muscle, which is the upper trapezius, starts from here and goes all the way to the base of the skull. When we're stretching it, you're seated with a good posture, not hunched like that, but good posture. Looking away from the side that you want to stretch. So I want to stretch this side. So you're looking away and down. You're looking at literally your opposite knee. And you're holding a nice gentle stretch on that area for about 30 seconds. And then you're repeating with the other side. Okay, even if the other side doesn't hurt, it's good to do both sides just to balance things out. The other thing I find is there's a muscle here called the SCM, or sternocleidomastoid. It starts from a little bone here behind the ear and onto this bone right there. So this SCM is this structure here. So I find a lot of my patients do have problems and tension there. I just get them to do a little pinch. So make sure you're pinching the right area. You don't want to be choking yourself. So I just turn my head. You can see it goes basically from there to there. You can look at it in the mirror if you're not sure where it is, and if you pinch it, it will have kind of like a good pain feeling. So it hurts, it feels tender, Sometimes you can get referred pain to the jaw or to the head, and this muscle can get quite restricted and tight and tense. So I find if those two things, so this muscle, I prefer not to tell people how to stretch it because it involves doing some funny movements that can actually make the joints inflamed, and I prefer not to inflame joints because once you've inflamed the joints, then you're in trouble. So really I find pinching the muscle is a good way to release it. Okay, you can do it a couple of times a day, and then stretching the upper trapezius like so, 30 seconds about 3 times a day. The other thing is also with people that have a forward rolling posture, where your shoulders are forward, I find a lot of bricklayers, a lot of people that do manual labour, anything heavy in front of their bodies can have this particular pattern of posture. So really, if you can do the opposite of that, so I get my patients to lie on a rolled up towel behind the spine all the way, and you could go to bigger, you can use a softer foam roller, but I prefer towels to start off with. You can build up to bigger resistance later on, but basically just rolling it behind your spine and just laying on it and just stretching backwards like that will help open up this area, because what you're trying to do is relax these muscles here and let this area just open up a little bit. The other thing is doing some exercises for the muscles that are called the rhomboids. So the rhomboids are the muscles basically of the shoulder blade. So anything where you do a rowing type exercises. You can even do a wall angel. So a wall angel is when you're up against the wall and you're pushing your shoulders back up against the wall. You can Google those exercises, they're commonly available, but a wall angel is quite effective. So once you've done those things, so you've got the upper traps, that's my favorite one because everybody has something wrong with the upper traps. You've got the sternocleidomastoid, pinching that, and doing the rowing or the wall angel to try to strengthen the rhomboids. They are really the top 3. Then going into headache territory, you do have a muscle here called the temporalis. So the temporalis is one of the chewing muscles. So if you get headaches or you're tense in general, I would suggest don't chew any chewing gum, because chewing gum means you're using this muscle. There is another muscle here called the masseter. If you're chewing all the time, that seems to make things worse. So we don't want that. So avoid chewing gum, please. Trying to press on here is also helpful. So the masseter, which is one of the other chewing muscles, to find it, all you have to do is just put your fingers just in front of your ear and a bit below. So the masseter goes, see where the cheekbone is, it goes right onto the jawbone. So it sits where my fingers are like that. Okay, so here to here. So you're just putting it there, clench your teeth, and then squeeze. It's this bit here, okay? So people might press that and go, oh, that actually hurts. So you might have a problem with the masseter. It might refer some pain up there. So that could be where your headache is coming from. And then the temporalis, commonly when you go get a head massage, they'll massage in that area. So you can self-massage there as well, just for a few seconds. Make sure that you're getting a good night's sleep, because that's helpful too. I do have a video about that because that will help reduce your neck pain and headaches. I found in a few of my patients, once they fix their sleep, then things seem to alleviate quite quickly. So the other structures that can cause neck pain could also be coming from the nerves. So the nerves are a bit more complicated. That does need further investigation. So if you're getting any pins and needles, numbness, tingling, there might be either impingement on the nerve from the bony area, which can be seen through an x-ray, or there might be impingement on the nerve from the discs, which can also, a different type of imaging is needed, or it could be something else that you really need to get investigated. So please, if you're getting any numbness, pins and needles, tingling into the hands or anywhere near this area here, it could very well be coming from any of those structures in the neck, so that warrants further investigation. The advice that I'm giving really today is just purely for tension in the muscles, and then joints and things like that. They can easily be adjusted at your chiropractor or physical therapist. So please, if you have any other questions, please don't hesitate to write below, and let me know what other topics are of interest to you. And next time I'll see you in good health. Take care.